Hello, I am Dr. NADIA QUEB. I am in the third year of Internal Medicine Residency Program at Hospital General de Especialidades in Campeche. The topic is cardiology, folio 35, cardiogenic shock as presentation of non-compaction cardiomyopathy. Left ventricular non-compaction cardiomyopathy is a myocardial abnormality morphologically characterized by an increased number of trabeculations. The clinical manifestations of left ventricular non-compaction can be very varied, from asymptomatic to sudden death. In the majority of cases, left ventricular non-compaction is asymptomatic or diagnosed accidentally. The most common clinical features are alterations in conduction and chronic heart failure. Although heart failure is common in these patients, acute heart failure and cardiogenic shock at presentation are uncommon. Echocardiographic and cardiomagnetic resonance imaging criteria have been developed to diagnose left ventricular non-compaction. Despite being the general criteria the most frequent applied to diagnose non-compaction, no consensus has been reached. The patient presented in this case had no relevant past medical history. He was a farmer with important physical activity and presented to the emergency department with complaint of worsening shortness of breath in the last month. The patient developed cardiogenic shock, required vasoactive and inotropic medication during his stay at the ICU. Workup refused acute coronary syndrome, and echocardiogram showed hypertrabeculation of the left ventricle with impaired ejection fraction. After parallel evolution, the patient was discharged with heart failure medication, and at further follow-up, improved left ventricular ejection fraction was demonstrated at the echocardiogram. The actual recommendation of treatment according guidelines are heart failure medication, antiarrhythmic drugs, and anticoagulation in cases of left ventricular ejection fraction less than 30%. In conclusion, the clinical manifestation of left ventricular non-compaction cardiomyopathy can be varied and represents in most cases a complex differential diagnosis protocol. Opportune diagnosis and treatment can improve the outcome and quality of life. Thank you.